Now, Dr. Pragati Singh is a medical graduate with a health management background. She's working at the National Health System Resource Center. She is committed to public health planning, and she also made program management monitoring as her focus of work and research. Doctor, you have 10 minutes, but I would like to ask the technical staff to restore the chronometer here in front of me, because I'm estimating. It's not running, the clock.
Thanks,
Go
Patrick.
ahead.
I'll keep it short and crisp. These 1.5 days has been an enriching experience for all of us. And we have been embarking constantly on this ambitious goal of universal health coverage, which will definitely require strengthening of the monitoring system of the current health program. And when we tell the current health program, I basically focus on NRHM. So our study was based on common review mission. There has been a constant efforts in NRHM for strengthening the evaluation and monitoring processes. There has been various concurrent evaluations, various other evaluations by other agencies, and common review mission is one of them. So to start with, common review mission, it's a yearly process, and it is undertaken every November of each year. First of all, to quickly go with the sites covered. Common review mission has covered till now 164 districts. In the first CRM, 35 districts were covered. The second CRM covered 32 districts. The third CRM covered 3 union territories and 14 states and 37 districts in all. The fourth CRM again covered 30 districts. And the fifth CRM in 2011, it covered 15 states and 30 districts. So in all, we can say that all of the states has been covered till now, except Manipur, Lakshadweep, Pondicherry, and Delhi. This graph is regarding the team composition of the CRM. CRM team is basically a multidisciplinary team. And one thing that I'd like to focus in this graph is that from second to fifth CRM, there has been a decreasing trend of public health experts, developmental partners, and NGO involvement in the team. So we will discuss it afterwards. This is about the themes that are covered under CRM. Basically, the last CRM worked on 15 themes, and it covered all the aspects of NRHM, starting from RCH, ERSH, and mainstreaming Ayush, infrastructure, and disease control itself. This slide presents a brief of how the CRM process usually takes place. So it starts with the briefing session at the central level, moves on with the presentation at the state capitals, followed by the field visits. And at this point, I'd like to take some more time. After the field visit, there is a discussion on summary findings at the state capital. Now, this is one of the most, I'll say, a positive feature of CRM, and where the CRM monitoring visits become more reflective. Then this is followed by draft report submission and the debriefing session at national level. So on this background, we actually worked on 4 research questions. Our first research question was basically to identify what parameters actually increased and declined in all the 5 CRMs. Did CRM help in knowledge generation and knowledge uptake? And we also compared it with the other evaluations along this period. The last research question was, did CRM help program managers in addressing the gap in implementation and monitoring of NRHM activities? So basically, we did 3 things as a methodology part. We did a document analysis of common review mission reports, and then the secondary data review was done. Here we took 4 evaluations for our study: a concurrent evaluation done by IAPS in 2009, the midterm evaluation by International Advisory Panel, the primary evaluation, and a recent evaluation study by Planning Commission. And we also did KIIs. We selected 3 states purposively, and out of those 3 states, we selected 1 or 2 districts, and then we interviewed various stakeholders, mission directors, the district officials, the state officials, and also the developmental partners that were basically involved in the CRM process. Now, the main thing, the findings. So, answering our first research question, we actually analyzed what parameters increased and declined across the 5 CRMs. A few of them we have discussed in sessions before this also. So on this side, there are all the parameters which have shown improvement, and on the other side, we have listed the parameters which has shown slight improvement or they have plateaued. So caseload and institutional deliveries, it was increased as the NRHM was launched, but the PPPs for EMOC and sterilization and the training component, it improved slightly. The ASHA functionality and effectiveness, it improved rapidly, but the support system of ASHA and community monitoring, it needs to be geared up further. The HR that we talked about in previous sessions also, HR has shown improvement. There was expansion of nursing education, there was mainstreaming of Ayush, but we still need to gear up the availability of specialists and the multi-skilling that we have been talking about. The functioning of SHS, DHS, RKS, but the SHSRCs and the management institutional structure and professionalization of the management, it didn't show that much improvement. The mobile medical units, referral transport system, and HMIS, Amit just now discussed about this thing. The state expenditure actually increased across the 5 CRM, but the ability to absorb fund, it was not improved to that extent. These are the factors that never took off or declined. Girja ma'am discussed in the previous session that TNMSC model, the Tamil Nadu Medical Services Corporation type of procurement and logistics system, we need to take it up. NGO participation, we started well with NGO participation, but with time it declined. Training of BMOC, IMNCI, public health cadre, we have been talking about a lot about this. Effective convergence action, measurably on social determinants. Here we are trying to just analyze the other evaluation process also, and quickly to run through this slide. The overall objective of all the evaluations and monitoring taken up during this period was to assess the implementation and the quality and effectivity of the implementation of NRHM. And all these evaluations covered all the themes of covered under NRHM, but certain evaluations like this primary evaluation by Kaveri Gill and evaluation study by Planning Commission, they also took beneficiary perspective. Now, all the other evaluations apart from CRM has been a one-time activity, but as I told you earlier, CRM is an activity that is being taken up every year. The stakeholders inclusion, largely all the stakeholders were included. The point I want to highlight here is that in the CRM, the developmental partners, NGOs and civil societies, they were basically involved in developing the methodology. And as far as the sample covered is concerned, concurrent evaluation survey, it largely covered 187 districts, and CRM till now has covered 164 districts. Other evaluations had been like more of the small sample surveys. And to the last point I'll go, the comprehensiveness of the report. When we studied these evaluation, we find that concurrent evaluation survey to be less comprehensive as compared to the other reports. In this thing, we were actually interested in finding the knowledge uptake of all this evaluation reports by the research articles, and we actually searched by using these keywords the research articles that were that cited these evaluation reports, and we find that CRM was cited at 27 places, the IAP report was cited at 6 places, and primary evaluation was cited at 15 places. Now this was based on the KIAs that we did, knowledge uptake by program managers. Here I'd like to emphasize that as far as awareness quotient goes, all the key respondents were aware of the CRM, and next to this was IAP report. And besides this, the report was presented to mission steering group, the working groups, HLAG, PC documents. They all basically considered the CRM report. And as far as CRM value addition by program manager goes, they actually responded that it's a kind of an in-depth monitoring, and it makes them aware of the aspects that they do not usually look for. Then it helped in the strengthening of the program, beside strengthening the district planning process, streamlining the NRHM activities, and the last point, which was a rather interesting one, it generated financial awareness, not among the district officials or the state officials, but also the PHC medical officers also. As far as CRM value addition findings for the participant goes, CRM has actually helped in knowledge enhancing and learning exercise for the developmental agencies, and it helps in pinpointing the key issues. And it acts as a technical assistance document for the technical assistance agencies itself. These are the suggested changes that we got in KIIs. They said that the more clarity is required on the recommendation part, and the most important one, most of them replied that there should be an institutionalization of a follow-up mechanism in the CRM. The other things are more general one regarding the pre-visit formats, composition of the team, then individual members' TOR, the inclusion of top-level administrator and ministers for the debriefing session. We also got this response, and the external evaluation dimension needs to be sustained. So in the first slide we saw in the graph that there was a declining trend of the developmental partners. To conclude, I'll conclude with what I started. The large-scale interventions like NRHM require new tools of assessment and review, and it is a rather difficult and challenging to monitor such programs because we usually do not have baselines, and usually the activities differ from different states to state. CRM is not just an integrated monitoring device, it is an evaluatory, it is a reflective process, and it focuses on learning through evaluating the contexts, through the process evaluation, and learning about the outputs and the outcomes itself. And as I said earlier, the CRM is basically focuses on the dialogue that occurs between the state level officials and the central level officials, and this has proven to be a very positive factor for CRM. Thank you, and I hope I haven't taken a long time. Welcome to the 6th CRM. It will be concluded in November this month.
Thank you very much.